Welcome back to OBGYN Champs, where we have the pleasure to sit down with the OBGYN champ herself, Dr. Suny Caminero. I'm Morgan Allen, and we have guest Janine Hogan in today to talk all things hormones and sex, because we love to talk about sex on this show.
Yeah, we do actually end up talking about sex a lot. Actually, it's probably because of hormones.
Yeah, you know,
and so many other things that are so important to women.
Yeah,
as well. Yes.
It's the main sexual organ of the body, so we got to talk about it. So let's dive right in, shall we?
I want to talk about hormones today, and I can't even tell you how many questions I get about hormones on a daily basis on social media. Like, there's not enough information really about hormones. So I'm so happy that we're doing this today so that people can women know that they're not alone. And this is kind of a process that happens to all of us if we live long enough, which is a good thing, right?
It's
a good thing.
You know,
if you live long enough, you're gonna
go through it.
You're gonna go through it. So, thank you, Janine, for being here for sharing your story, because I really want to ask you, tell me, how did you start having hormone changes, and then what was your process to get to today?
Yeah. Oh, well, for me, I had our daughter later, right? So I didn't really know a lot was going on until postpartum, and it was a very rough journey. So for me, I feel like that was kind of the first clue that something wasn't really kind of firing the way it was supposed to. So it took a while. It took a really long time. So I was starting to see things change slowly. It would be one thing after another. It wasn't just everything happened all at once, and then I knew something was like, oh, it's my hormones. I really didn't know. I actually thought that there were very serious things wrong with me, or starting to be wrong with me, because my body just felt out of whack mentally. Lots of brain fog. I could walk into a room and not even remember why I stepped into the room, not remember a conversation I had 5 minutes ago. Just things that you start to feel like, this isn't me. Like, what's going on? I remember looking in the mirror a couple of times in the bathroom and just being like, I don't recognize this person, So it was there was a lot of emotional things. I felt like a roller coaster all the time. Like, little tiny things would set me off, very irritable. And that's just not my personality. It's not who I am. I'm usually very fluid and easygoing, and I like to bring some light and fun to things, and that just wasn't happening. And then my body physically started to do things. So I was, skipping a lot of periods. Quite honestly, I hope this isn't too much TMI, but I took more pregnancy tests going through this than I did my entire life. It was because I was like, what is happening? I would skip periods like crazy, or they would be really long or really short. I was going to acupuncture. I tried supplements. I went through functional medical doctors. I was like, what's happening? And it was, blood work looks fine. Blood work's good. You're fine. I'm like, okay. I'm like, well, I'm not fine.
Yes.
So it got to the point where I just started searching for answers. I went to lots of different doctors. I was, doing virtual calls with doctors out of state because I thought that they had the answer. And quite honestly, nobody was really spending the time with me at all. So they didn't listen enough. And I wasn't being educated at all on what was happening, and maybe giving me a reason why, until I found you, quite honestly. And that took 6 years. So I had gone through all of this for a really long time. Yeah. So it was the hot flashes. I'd be in meetings and client meetings, and I'd be like, oh my gosh, I'm sweating ridiculously right now. And then my heart would race, and I'm like, I need to get out of this room. So, it got to the point where it was negatively affecting my life and my daily operations, everything, my relationship, just how I was as a mom, just, it was hell.
Yes.
So, and then when I found you, you were the first person that actually gave me reasons as to why. I learned more in 1 hour with you about what was happening to my body than I have my entire life. So I wasn't prepared for any of this. And so, I really thank you for that, because it really, knowing and having the information helped to connect the dots, and then made the recovery of this and getting back on track so much easier. So,
thank you, Janine, for sharing your story. Your story is one that I hear on a daily basis, unfortunately, and I think it's going to get better, but we still have a long way to go. And one of the things that people, women, tell me about is that feeling of I'm not myself. It is a word that I hear over and over and over again. I'm not myself, and also trying to find answers and having to go through so many places to try to find answers as to what's happening. You're not in medicine. You wouldn't know, right? You did all of the homework to the online, out of state, the this medicine and that medicine and this supplement and that supplement and exercise and eat healthy and change all of that. And the things that even when you change all of that, if your hormone isn't well, everything, you have an effect, and your entire body responds to hormone from the tip of your hair all the way to your toe. That includes your brain, your bone, your skin, your muscles, your stomach. Everything responds to hormones. So if your hormones again are not normal, then you're gonna not feel well. And the issue with the lab is one that I see often. And it is because we have such a range when it comes to the labs for the estrogen, the testosterone, the progesterone. The range is so wide that almost all women fall into the normal range, right? Unless you're really postmenopausal, you will fall into the normal range. So you suffer through all these years, often 10 years of suffering because you can't because you're following into this normal range on the labs and not really looking at what is the actual optimal range for the hormones. And then obviously once that gets replaced, kind of like if somebody has a thyroid hormone issue and you replace a thyroid, now you're better, right? If somebody's diabetic and they have an insulin issue and you give them insulin, then they're better. For some reason, we feel as if female hormones are different and that we don't need to replace them, like we have to replace all the other hormones that our body, loses or has a disease of. So I'm really thankful that you're sharing your story, because it is a story that so many people are going to not only recognize, and for women who are going through it right now, they would recognize too what's happening to them as well.
Sure.
And then the other thing that I wanted to talk about, because I think this is super important, is testosterone. Testosterone is like this I don't know why it's a hot topic, honestly, but testosterone and estrogen are both female hormones. But for the longest time, we've always been talked about that estrogen is a female hormone, testosterone is a male hormone. And so often women do not get testosterone replacement therapy, which is extremely important for so many things because it's considered a male hormone. As opposed to knowing that both estrogen and testosterone is a female hormone and both estrogen and testosterone are male hormones. It is just at different levels, right? We all carry it at different levels, but those hormones have an effect, again, on the entire body.
Yeah.
I don't know if you wanted to share anything regarding testosterone therapy. How do you feel? What would you,
So I'd like
what
to,
did you see?
So one of the things I think is important to talk about is, throughout that 6-year time, I was going through, well, let's adjust this. I mean, it was like every time I had a visit, it was like adjust, come off. And it was like my body was just constantly in I didn't even know what mode it was in. It could not figure itself out. So I think what's really helped me is you have a very keen approach, and your process and your way of thinking about it is more detailed than what I was experiencing before. So within the first, I think I'm into 3 months now. This first period here, it was like, it only took 3 or 4 weeks, and I was like, I'm back. And it was a noticeable difference. The hot flashes went away. I was sleeping through the night. I didn't have the night sweats. I wasn't irritable. Things started to get back to normal, and I was able to notice it. So for me, the combination of things that you did was really important, because the type of progesterone you put me on, the compounded micronized, I think that was very different from the other progesterone. The other progesterone made me feel crazy. So, and they tried all different types. There was one I had to put under my tongue. It tasted disgusting. There was another one they just kept It was oral, but it was like a generic oral. I mean, it really made a difference, the approach that you had and where those medications were coming from. So I think that changed a lot too. So the combination of things, I think, just works. The testosterone for me, I wasn't on it before. My energy is a lot better. My stamina is a lot better. My sex drive was coming back. I had no libido at all. My poor husband was probably like, what's going on with my wife? But it was, and I wanted it to be there. And it was like, I felt like I was forcing myself to try and like conjure something up. And it was very frustrating. So, once that started to kick in, I was like, okay, like I'm starting to feel like more interested again. And this is healthy now, and it wasn't me just trying to appease my husband or trying to make my body do something it wasn't wanting to do.
Keep your marriage going.
So we got to keep that fire alive, right?
Exactly.
So, but it was a total body change. So mentally and then physically too, but then also, I think it helped me. Like I do a lot of like CrossFit workouts too. So we train a lot, and, I wasn't able to kind of cross over into different plateaus. I wasn't getting stronger. I wasn't really seeing the results I wanted. And, you put a lot of time and effort into that. So it was like, this isn't working for me, but now it is, so I think it's supporting the lifestyle that I have too, which is important.
And you have, like you said, you end up gaining more lean muscle when you exercise, as opposed to losing muscle or not feeling like you're getting anywhere with it.
Yeah.
And then you also recover faster, right? If you have an injury, we're much more prone to injury after 40. So if you have an injury, you recover much faster because you have the blood flow, you have what you need essentially. So I'm really glad that experience has been good for you, and that we were able to help you out significantly. And I'm so happy that you're sharing your story, because like I said, it is the story of so many women after 40. And perimenopause can happen really 10 years or more before actually full menopause occurs. And for some women, that process starts at 35. For some women, it starts at 40. For some women, it starts at 45. So you really don't know until you start to have those symptoms whether that's going to be you or not. For women who have endometriosis, which is a common diagnosis for women, for them it happens faster than women that don't have endometriosis. And the reason for that is because endometriosis is an inflammatory condition that is in your pelvis, right? So your ovaries are in an inflammatory environment, your uterus in an inflammatory environment, but most specifically the ovary. And so it ages the ovary. If you think about somebody who's exposed to war every day, they age faster, right? Well, the ovary is exposed to an inflammatory condition every day, so that it ages faster. And because it ages faster, the hormones that can produce decrease much faster than for women who don't have endometriosis.
That makes sense.
Yeah. So let's talk more about how your approach is towards finding the right cocktail of hormones and balancing that, if you will.
So there's so many options when it comes to providing you the hormones that you need, whether it's estrogen, testosterone, progesterone. And so it depends on the labs, but also the symptoms that we're trying to fix. So it's not just labs. So I don't really often, I get labs, but I'm not like labs every 3 months or anything like that. Initially at first to manage, but your symptoms matter so much more to me than anything. Your symptoms will tell me exactly how you're like, how high to go on the medicine, what to start the medicine, how low to start on the medicine, in addition to medical history, right? So if you have a medical history that predisposes you to certain conditions, then I have to pay attention to that as well. And also the lifestyle matters. So in the sense that there's creams, there's gels, there's troches, there's pellets, there are patches, there's pills, there's so many ways of doing hormones. And the choice depends on medical condition, what we're trying to treat, and then lifestyle. As an example, we do pellets in the office, but not a lot. Like those are kind of minimal things that we do. That's another modality of giving hormones to women. But I have patients who travel across the country and across the world, and they're just busy. They don't have time to carry a cream. They don't have time to carry one more thing in their bag. And for them, the pellets are great. In and out, 3 months, you're done.
Is that like a suppository?
It's something that we put on your gluteal muscle, and then it stays there for 3 months. And then in 3 months, it kind of dissolves over time. And in 3 months, you don't have the effects anymore. So then you have to redo it again.
You like inject it like a shot?
Yeah. Yes, it goes in with it's called a trocar, but it's kind of like a hollow end needle, large hollow end needle. They don't feel it because we numb it. But that's just an easy in and out. I'm not a fan of that in the long term, because in the long term, you keep putting things in there, you're going to get scar tissue. So I'm not a fan of it for the long term, but I'm a fan of it for a specific population this is like life right now for them, essentially. And then there's the creams, and it depends on whether you absorb it well. If you don't absorb it well, there's the patches. There's just so many ways of doing hormone. And sometimes I get lucky and I find the right exact, recipe for you. And other times we got to tweak it a little bit. Janine responds a little bit faster than for most women, actually. For many women, the response, it takes them 3 months to feel like they're really getting somewhere. 6 months to go, man, this is amazing. So I think that in 6 months, you're going to be even better.
I think I was so depleted that my body was like, thank you.
Wow.
Yes.
Oh my goodness.
But we also look at not just the hormones, but lifestyle. So we look at, what is your vitamin level? Like, are you depleting in vitamin D, which is extremely important. Vitamin D is a hormone. It's not really a vitamin. They misnamed it completely. And so vitamin D, what is your B12? What is your insulin level? Are you eating healthy? Are you exercising? All of that also plays a role. Janine was already doing that. She was already exercising. You're already eating healthy. She was doing all of it, and it wasn't working. But that still is part of it. And most women at a year of it's not only being on hormones, but doing the lifestyle changes, they're just, at a year, they feel amazing, and they live longer. And they live happier, active, which is really what we want, right? Like the whole thing is to live longer, healthy, happy, active, moving.
Yes. Wow. So for people, my age, you kind of touched on it. Like, it could be a vitamin A, it could be a vitamin D deficiency, but before perimenopause, could we have hormone imbalances?
You certainly can. There are many your lifestyle has a lot to do with hormone imbalances. If you eat healthy, non-toxic, as much as you possibly can, you can control everything, right? But as much as you possibly can, and exercise, you can keep your hormones really, really optimized. If you're not on birth control and you're having a period every single month, that is a good sign that your hormones are good.
Okay.
If you're missing a period, that's a good sign that there is a hormonal imbalance there.
Gotcha. Okay. Yeah. And so let's talk about sex. Finally.
Yes.
Come on. Whenever you have your hormones in balance, does sex feel better? Do orgasms feel better? Is everything, more
everything
fun,
feels better.
great?
Everything feels better. And it feels better because you don't have the dryness that comes from not having your hormones. Also, when you don't have your hormones, your nerves, it's almost like they try to go away. Like you just don't have the sensation that you had before. Yeah. It's like she died. Like the clitoris died, the G-spot died. Like you have zero interest in anything. And so she doesn't even talk to you. When you're young and you're 18, 20, 25, you can walk around and go, oh, I'm horny. Yeah. Right? Like you can, like literally, like that happens, right? And then that goes away, like completely goes away when your hormones are low. And so that comes back when you get back, your hormones back. Many women, when they don't have hormones, they avoid their husbands, and they do certain things like, oh, please don't touch me today. Don't touch me today, because you're going to want to have sex today. Right. Or like, oh, he's passing by me. Please don't touch my butt. Don't touch my butt. Like,
oh my gosh.
Like little insidious little things like that happen. And, or I'm going to fall asleep right now. Like all the excuses,
it's like your body goes into defense mode.
Yes.
It's like, that's what it is. It's like, I need to just know. No.
Yeah.
Yeah.
So these are the red flags that women need to watch out for and realize, okay, if I
You're
don't
trying
want my
to
husband to
avoid it.
touch my butt today, I'm probably having hormone issues. Need to get that checked out.
Yes, exactly.
That makes sense.
That comes back once your hormones back to normal. You feel back in your 30s, for example, where that wasn't the case, right? It's the hormones are not going to make you want to have sex as much as men do. It's just not going to do that. Our levels are totally different than for men. Men's testosterone is levels usually 700, 900. Ours is 40. It's never going to be like the men, right? But it can be normal for women where we actually want it, where she's talking to you, where she's saying, hey, let's do it. Go grab him, go touch him.
Which
not
that's,
avoid it.
every man's dream right there. Every husband that's what they want.
Exactly.
So
by the way, this happens to men too. This isn't just for women. This happens to men too. So men, a hormone level does decrease as well, and particularly testosterone. And they start to feel like their erection isn't as strong as it used to be, or that they can't keep the erection as long as they used to have either. And also that they're not as interested. When they wanted it 3 times a day, now they want it maybe once every 2 weeks or maybe once a week, which is not necessarily natural for men. And so for men, that happens too. I have patients that send me their husbands, and in particular, just this past week, I had a patient that sent me her husband, and on our we call it a sticky note on our EMR system. It's like a note to tell ourselves, and then the note said, "Wife said, don't talk to him about money, just take care of him, and then charge her card."
I love it
because she's fixed, and she's now go fix my husband.
Yes,
right.
Because she's ready to go. She is reared and ready to go, and
exactly.
Now he needs to get on board.
Yes,
I love that. So let's talk about the alternative, having a little too much testosterone. I've heard a myth recently from some bodybuilder friends of mine that if they have a little too much testosterone, the clitoris can become long and then have its own erections. Is this a real thing?
It is a real thing. Yes, it is a real thing. So hormones have to be in the normal balance level, not too high. Just like with anything, too much Tylenol is not good, right? Yeah. Too much sugar is not good. Testosterone, estrogen, all of it is the same. And there are people who are on high levels of testosterone that shouldn't. And particularly injectable testosterone for women that's not my favorite. It really is not natural for women to have, but those are when I see the most issues. And high levels of testosterone for women, when women get to the 200, 300, I've seen women at 400 levels. That's totally not normal for women. And their clitoris keeps getting larger and larger and larger. And the head of the clitoris also gets bigger. So it actually looks like a micropenis. And it does have erections. And so for those, what happens is that is a permanent issue. That is not something that gets resolved. That is not something that goes away when you stop your hormones. It stays that way.
That's wild.
Yes. And so because of that, believe it or not, now I'm doing a lot of surgeries to fix that for women because of so many women are on testosterone, not the right way. Okay. And because they're not on it the right way, they're having this issue across the country. They're having this issue. And the other issue that changes is the voices. So women start to speak as if they're more raspier, almost like if they're smokers, or as if more manly kind of voice. And the voice change also doesn't go away. Doesn't go away. And I have had patients that come to me that they notice it, like singers, that they notice that their voice started to change. And that's what it was like, I stopped it right away because my voice started to change. And thankfully they stopped it soon enough that it wasn't a permanent thing. But that can happen, and it's not necessarily something that people think about when they're starting therapy.
So that's very important to become aware of.
Absolutely.
Especially if you're self-treating, which is it.
And some people do that because they're going out to find out who can help them, and nobody's helping. Yeah. And so then they go through black market or whatever the case may be to get it. Or they get their husbands. So if their husbands are on testosterone, sometimes women will use their husband's testosterone and inject themselves with it. Well, they're injecting themselves with super high doses because they don't know, right? They just want to, and then they feel better. they put it on. They're like, this is the best thing ever, right? I have all this energy. I want to have sex all the time. We're having a great relationship. And then over and over and over and over a period of time, then you start having the side effects of it.
And then boom, micro penis.
And then go boom, micro penis.
So it's very
And
important
hair
to be
loss.
aware of that.
And hair loss.
Hair loss too? With
Huge
that?
hair loss. Yeah.
Dang.
And hair loss. So now you have hair loss and a micro penis.
Oh, we don't need that. Okay, that's why we do this show, is because we need awareness on these important
That's exactly
details.
Right. That's exactly right. So I don't want people to be scared of testosterone therapy, because for us women, it's extremely important. That brain clarity is huge with testosterone. It actually decreases. This is super important. It decreases your risk of breast cancer. Testosterone therapy has been shown to decrease your risk of breast cancer.
Wow.
Huge. Okay. So is vitamin D. Normal, good vitamin D level also decreases your risk of breast cancer and decreases risk of dementia. Testosterone is also for skin, for muscle, for bone. You know, women who end up with osteoporosis, osteopenia, the first thing we go to is giving them something, a medicine, a pharmacologic agent, as opposed to giving them their hormones back.
That's wild.
It is wild, because forever and ever and ever we've go hormones are bad. Well, it doesn't make sense evolutionary wise to that your ovaries will start to make a hormone to kill you, right? Like it doesn't make sense, right? So for all this, hormones are bad, hormones are bad. Oh, hormones are not bad, right? Like normal hormones that your body produces are good hormones, and thankfully they can make those in the lab that mimics exactly what your body makes. It doesn't have to be a synthetic hormone anymore.
Yeah.
This is so good to know. Dr. Suny, thank you so much for sharing your expertise with us.
Thank you.
Always a pleasure, Janine.
Thank you for sharing your
Thank
story.
you
for
Thank
coming
so
on,
much.
Janine.
Yes.
I mean, honestly, it's because of her.
Yeah.
So
Yeah.
I'm like, you can't get rid of me.
I love it. Well, it's great to see your case study in the flesh.
Yes. I love
it. And viewers, we thank you for tuning in to another episode of OBGYN Champs. If you want more information on Cosmetic Gynecology of Florida, you can check out the website right underneath this video. We'll see you in the next episode of OBGYN Champs.
Hi, I am Dr. Suny Caminero, and I am a board-certified gynecologist in Florida and founder of Cosmetic Gynecology Florida. I opened this practice because I wanted to give women the care they deserve and be able to provide a comprehensive treatment for women in one location. Here in Cosmetic Gynecology, we really focus on the topics that women are embarrassed to talk about. It's the things that affect women on how they feel in their body, how they function, how they have their relationship, their self-esteem, and the things that are blocking them from being the best self that they can be. Anything that has to do with their vagina, with their labia, with their clitoris, all of those things are really hush-hush, and women are not encouraged to talk about, and also they're embarrassed to talk about it. Urinary incontinence, hormonal imbalance, just not feeling comfortable in your own body. These are the issues that we want to solve. Over the years, I have obtained specialized training to be able to provide care for women in the different aspects that affect their individual parts as well as the whole part. We have curated this entire experience to give you the solutions and the results that you deserve. From the moment you walk in through this door, it is a safe environment. It is a calm setting. What we want is for you to feel comfortable to discuss anything with us. When you're completely comfortable talking about what's going on, we can give you real answers. Everything that we do in this office is thoughtful, is private, and is centered around you. There is no pressure, there is no judgment, there is just real solutions. Because your quality of life is not an option. Expect more from your body, and we are here to help you live your best life.